I'm Hany Elmariah. I'm an associate member at the Moffitt Cancer Center here at the ASH Annual Conference in San Diego, presenting my poster, Non-Engrafting CD8-Depleted Human Leukocyte Antigen Mismatched Unrelated Donor Lymphocyte Infusion for patients with myelodysplastic syndromes and secondary acute myeloid leukemia. So patients with myelodysplastic syndromes that have high-risk disease are usually treated with a class of chemotherapy drugs called hypomethylating agents. In cases where their disease is refractory or relapses after hypomethylating agents or progresses to AML, the prognosis is very poor, about 6 months. So we developed this new cellular therapy to try to get these patients into remission. The way that it works is that we collected a pool of donors at another third party that we contracted with at the New York Blood Center. There was 30 donors in the pool, and we chose cells that were intentionally HLA mismatched from the patient, and then infused them into the patients at the time of getting also induction chemotherapy to try to get them into remission. So there's some key aspects that are unique about this cell therapy product. The first is because it's HLA mismatched, theoretically it would cause a risk of graft versus host disease, which is where the cells attack the patient's body. To prevent that, we depleted the cells of a class of lymphocytes called CD8 positive lymphocytes. So we did this CD8 lymphocyte depletion, and the downside of that, or the effect of that, is that then you don't get full engraftment of the cells, so it's not permanent. So the cells go in, but with this HLA mismatch, you get a big cytokine response, an immune response that causes an attack against the tumor, gets them into remission, and then these donor cells are ultimately rejected without causing graft versus host disease. So when we did this clinically, we did a dose escalation study where the patients got one of 3 dose levels. So at the lowest dose level, we had no responses. At the second dose level, we had 1 out of 3 patients who got responses, and at the third dose level, which was this group of patients here, we had 7 out of 13 patients who achieved a complete remission. We also didn't see any major toxicity, no dose-limiting toxicities, no treatment-related deaths, and no graft versus host disease. So we're excited about this new treatment. It's a first-in-human type of concept that hasn't been done anywhere else, and it's only been done at Moffitt, and hopefully we'll do some larger clinical trials in the future to confirm the promising results that we saw here.